Trump says he's signing an executive order to reduce pharmaceutical prices by 30 to 80% almost immediately. I'm very skeptical when the government tries to set prices, but let's think about this for a second. But I have to recognize that the pharmaceutical market is not currently a free market. For example, we have intellectual property laws that create artificial monopolies for pharmaceutical companies that come up with a new pharmaceutical. If you come up with a new thing and get a patent on it, you might be the only company allowed to sell it for 20 years. And then, since we have that artificial monopoly created for you, you could sell it at a much higher price because you're the only one allowed to sell it. Or if we're ever in a situation where a pill costs $1,000 in the United States and $1 in France for whatever reason, why doesn't my pharmacy just buy it from France and resell it to me for $2 or $3? Still a huge markup, but a lot cheaper. Well, the answer to that is there's an FDA regulation prohibiting American pharmacies from sourcing pharmaceuticals from other countries. So, all that said, I'm skeptical, but let's look at the executive order a bit. The executive order says the United States is less than 5% of the world's population, yet funds roughly 75% of global pharmaceutical profits. I'm not sure where this claim is coming from. They don't give a source. There's a 2018 report from Trump's previous Council of Economic Advisors, which says that the US makes up roughly half of pharmaceutical revenue and 78% of pharmaceutical profits, despite the fact that the United States made up only 34% of OECD GDP at purchasing power parity. Meaning, roughly, we have 34% of the money, we buy half of the pharmaceuticals, so we're buying more pharmaceuticals than other countries, and we make up 3/4 of the profits. In the OECD, not the whole globe, so just a set of 20 or so countries. So this comparison of population to profits might make you think we're paying 15 times our fair share, but probably it's more like 2 or 3 times. So the executive order says Americans will no longer be forced to pay almost 3 times more for the exact same medicines, often made in the exact same factories. As the largest purchaser of pharmaceuticals, Americans should get the best deal. In other words, you can't sell pharmaceuticals in other countries for less than you sell them in America. America has to get the best price. So is this bad for pharmaceutical companies? I mean, you might think they're going to be making a lot less profit now, right? I looked at the top 5 pharmaceutical companies over the last 5 days, their share price, and I found that on average they had decreased by 2%, so a negative 2% change over the last 5 days. 4 out of 5 of the companies had declining share price, and that's compared to the S&P 500, which is up 5% over the same span. So it looks like this is kind of bad, but it's not like existential, destroying the company level bad. And the stock market change kind of makes me skeptical that there will be a huge change here. Like if you thought we were going to wipe out 75% of your profits or cut those in half, then I'd expect a bigger move in the share price. And partly that may be because the markets are expecting the American share of profits will go down, but pharmaceutical companies will raise prices in foreign countries in order to reduce how much they have to cut their prices if they were complying with this. Or maybe investors don't think this is actually going to happen. I don't know. There's this interesting section which says if no action is taken, if the American patient isn't getting the best pricing, then they're going to go to Congress and say that actually importing pharmaceuticals from other countries won't pose any kind of risk or problem for the American patient, and it may make pharmaceuticals cheaper. And so then they're going to grant licenses to let companies do the importing from other countries. And I think this section goes back to what I said at the beginning. If there's a pill that costs $1,000 in the US and $1 in France, there's currently some regulation preventing us from buying the French version, so they're going to get rid of or waive that regulation if the pharmaceutical companies don't give American consumers the best price. Finally, what will all this mean for healthcare spending? Well, there's a report from the Rand Corporation that says pharmaceuticals make up 10% of total healthcare spend. If we take Trump's estimation that this will reduce pharmaceutical prices by 30 to 80%, then I guess we're talking about taking 3 to 8 percentage points off of healthcare spending. which would be good if there were no other negative side effects. Personally, I think we should just definitely go ahead and do the thing where we are allowed to import pharmaceuticals from other countries, because it seems like that would get the most favored nation status anyway. If you free up the markets, then people will just naturally buy stuff from the countries where it's cheap, plus we'll pay a little bit in shipping, and that doesn't seem a big deal. Anyway, thanks for your time.